EMR checkout workflow. Now, depending on local scenarios, checkout may be part of either the front or back office responsibility. Your local processes is what will determine the exact workflow, such as, do you book the follow-up appointment? Are you simply printing out documents for the patient as they leave, such as their lab and radiology orders, prescriptions, or education handouts? Is the patient being referred to another provider? And if so, do you need to obtain pre-certification or authorization, such as for surgical procedures, either within your own practice for their next visit or outside, MRIs, and so on? So I'm going to toggle into prognosis. We see here that we have Olivia Pope highlighted, and her status shows as ready for checkout. So taking those different scenarios, if I click the Take Appointment icon up here in my system tray, notice it already defaults to Olivia Pope, to Dr. Cooper at Bayside, because that is the current appointment location and attending doctor. It's assuming that the follow-up is for the same doctor, same location. If that is the case, I don't have to change anything but come in here and click my search link, and that will activate Dr. Cooper's work pattern for that location. I simply click Find. I can say Find Next until I get the available slot that the patient would like, and then I can select that slot, and that will then update my appointment date and time appropriately. Of course, you want to verify that you've got the appropriate encounter type and specify the reason for the visit. Now, let's say you also need to give Olivia a referral because you're referring her out to a specialist. If we go under our Patient tab, we choose the option called Letters Out. Now, there is a separate video on this module, of course, on the Resource Center, so I'm not going to go into the details of how to fill this out, but let's say that we're going to just send this to our referring Dr. Isles. We can select our referral template letter. If it is a referral within the context of transitioning of care for meaningful use, we do want to make sure we click this TOC checkbox. We also then want to make sure that we go in and attach our continuity of care document, which is the meaningful use compliance piece for that referral. If we're not interested in meaningful use and we're simply printing a referral letter, we would not need to do that attachment. I'm going to save it, and then I have my action options up here, whether I want to print it, fax it, email it, or download it to a thumb drive, whichever media you prefer. Now, at the same time you are doing a referral, you may or may not also be bringing the patient back into your practice for an MRI or a procedure that you need to obtain certification for. So again, under our Patient tab, with this time going to go down and choose Clinic Forms. Notice on the left it defaults to our patient Olivia. We can bring in our authorization tracking form, fill out all of the required data as far as the reason for the referral, when, and so on. If we at the front desk, we're setting it up for our pre-certification department, we can go into the Save Notify. If we have set up a pre-certification distribution list, we can go ahead and choose that distribution list, and it will go to all of the appropriate personnel in that pre-cert department with an attachment to this clinic form. And then the last part of doing a checkout, whether or not you had a referral pre-certification and whether or not you created a follow-up appointment, maybe you just need to print the documents for today's visit. So again, while she's highlighted here on the home page, you have the Checkout Docs icon. And this will be reflective of all of the documentation that has been accumulating during the visit. So as the doctor and the nurses are treating the patient, doing allergy shots, ordering labs, writing prescriptions, this would give you an opportunity at the front desk in a single click to print all of those documents in one print job and then hand them all to the patient as they are leaving from your front desk. Once a patient is checked out, of course, the final step is for the physician to mark the encounter complete and sign off. Some offices will define custom statuses to inform the doctor of this, and others don't. So this, of course, again, will vary based on local process. But if you are going to define those custom statuses, at this point you would click the workflow icon. For instance, I have one called Done, and then click OK. And as we see here, the status has updated to Done, which helps distinguish those patients who are gone and that the doctor needs to sign off versus the charts that still need attention.